Good afternoon. In the next few minutes, I'd like to introduce my progression in PhD thesis titled The Association Between Fluid Therapy and Organ Dysfunction in Critically Ill Patients. My name is Ildikó Szántó. I'm a first-year PhD student and an anesthesiologist and intensive specialist in Nyíregyháza. In my work, I have a personal vision to use in everyday clinical practice science-based fluid therapy for better organ functions. And our mission to achieve this is to optimize therapies for critical ill patients through tailored fluid strategies. At the moment, we have two ongoing projects which are very similar to each other. We would like to investigating the effects of balanced crystalloids versus isotonic saline in two different populations. First in patients undergoing major surgery and after it in septic shock patients. Let's see a common background of these topics. The problem is that when the patient has hemodynamic instability, we use as a first choice the fluid administration. In this case, our first choice is crystalloid solutions. There are two main types of crystalloid solutions, the balanced and unbalanced solutions. On the slide, you can see an example of both. 0.9 saline or isotonic saline is representative of unbalanced solutions. The problem is the concentration of chloride of it. As you can see, the concentration of chloride of isotonic saline is about 50% higher than the concentration of balanced crystalloids or the blood. And this excessive fluid intake can be harmful for the patient, causing serious metabolic acidosis or arrhythmias. So let's have a closer look at our first topic, which is a systematic review and meta-analysis. The problem is that the high number of major surgeries worldwide, and this is further exacerbated by the relatively high rate of postoperative complication associated with it. And we have some guidelines, for example, RASH guidelines, which suggest the using of balanced crystalloids as a first choice, but we have not enough evidence on how type of fluid influences the clinical outcomes. That's why our aim is to investigate the two most commonly used perioperative fluids and whether the choice of fluid affects the postoperative complications in patients after major surgery. Our clinical question is perioperative fluid therapy with balanced crystalloids more beneficial than isotonic saline in preventing postoperative complications. To answer this, we use PICO framework, and at the end we hypothesize that using balanced crystalloid is superior to using isotonic saline to decrease postoperative complications. With that, we conducted the systematic search at 10th of November in the last year with this search key in the 5 main databases. And the end of the selection process, we got 29 eligible full-text articles. So we finished the analysis for two main postoperative outcomes, and there are some other postoperative outcomes and the secondary outcomes, which is under analysis. So on the first plot, you can see our outcome, which is the renal postoperative complications. That is important for us because these complications affects the morbidity and mortality of the patients as well as their long-term prognosis. You can see in this plot 5 articles. These are all of them randomized control trials, and we could analyze more than 10,000 patients in this part. And you can see we use the odds ratio as a measurement, and the overall risk ratio of the population is 0.96. And you can see that in the renal patients, which means that these patients had kidney transplantation, all of them, the risk ratio was 0.82. That results means that in overall population there is no such difference between the complication rate of renal complications, but in this subpopulation, which means the kidney transplantation patient, this result is clinically important but not significant, that we can see a relative tendency with using balanced electrolytes has a lower rate of renal complication of the patient. Our heterogeneity, overall heterogeneity is 64%, which it's a moderate heterogeneity. And the reason for this could be the population. There are many types of surgery, and the other cause could be that there are some articles which measure the fluid intake perioperatively, and there is one article which measured only the intraoperative intake of fluid measurement. So these results indicate that we need more further studies or analysis to identify those cases where the balanced solution could be help for us to reduce the postoperative renal complications. On the other slide, you can see the cardiovascular complications. We also used randomized control trials and almost also 10,000 patients. The overall risk ratio was in this case 0.83, which means that in the balanced electrolyte solution treated patients had fewer postoperative cardiovascular complications, and this result was statistically significant also. Our strength was that we can use only randomized control trials and a very high number of analyzed patients, but we have also limitations, which means the heterogeneity of the population and different study types in the analysis. Our preliminary conclusion is for practice that balanced crystalloids can reduce the cardiovascular complication, and our implication for the research that further studies needs with homogeneous population could provide better evidence. Our project progresses in data extraction phase because there are so many secondary outcomes which is under analysis. Our second project, in a few words, is also a systematic review and meta-analysis. In this case, the problem is the septic shock patients' incidence in the intensive care units is very high and is associated with a high mortality rate. And according to the surviving sepsis guideline, we have a weak evidence level for using balanced electrolyte solutions. And there is an insufficient evidence on how fluid type influences organ dysfunction. So we want to investigate how balanced crystalloids versus isotonic saline affects organ dysfunction in septic shock patients. Our clinical question, does using balanced crystalloid decrease organ dysfunction compared to isotonic saline? We use also PICU framework, where our patients, septic shock patients, we compared also balanced crystalloids with isotonic saline, and our primary outcome would be the development of organ dysfunction based on the SOFA score. We hypothesize also that using balanced crystalloids is superior to isotonic saline and is associated with a decrease in organ dysfunction in septic shock patients. And our clinical implication would be that using the most appropriate type of fluid can decrease the incidence of organ dysfunction. So to summarize my aims, I would like to submit my papers in this year. And I would like to finish my presentation with a quote from Lajos Kossuth: "We have to bring life into science to bring science out into life." Thank you for your attention.
Thank you very much, Ildikó. Very nice presentation.
Thanks.
I have a question. You said that, and we know that the normal saline can induce renal failure.
Yeah.
And my question is about that, whether I use balanced solution in the perioperative settings, I can reduce the need of renal replacement therapy.
Yes, almost. Because of the time, I couldn't see it in details, but the renal complications in this population means that those patients who need for renal replacement therapy and those who had renal failure based on, for example, the decreased urine output. And this population, which was the top of the slide, where I mentioned they were after kidney transplantation, the outcome was in all articles and in all patients, the need for renal replacement therapy. So that's why I could say that in this population we see that there were fewer development of renal complication. It means however fewer need for renal replacement therapy with using balanced electrolyte solutions.
Thank you very much.
Thank you for your nice presentation. I was wondering if was the volume of the fluid they used was comparable between balanced crystalloid and saline?
We plan this comparison, but we are in the data extraction phase of these results, but we plan this.
Thank you.
Thanks.
I know the project in and out, but I'm very curious about your own professional experience right now. Yeah. Since you have started, as a specialist, since you have started investigating this topic, yes. How have your clinical practice and your colleagues' clinical practice changed?
My clinical practice didn't change because, if I could say, I almost never used isotonic saline. So I always use the balanced electrolytes. But some of my patients, especially in the operation room, started to reduce the use of isotonic saline because there I saw that it's a using. Yeah.